Hi, this is Brian Kim. I'm going to share with you this case of a patient with intraoperative floppy iris syndrome, or IFIS. And of course, you can use rings, hooks, and all this types of stuff on every single case. And if you do that on every single case, you will be able to control IFIS. But the question is, do you really need to use iris hooks and rings on every single case? No, I think it's a waste of time, and I think it's a lot more work. And there's always risks whenever you do these things. So how can you, not using any extra devices, protect the pupil? And so these are my top 4 tips to protect the pupil during cataract surgery in the case of an intraoperative floppy iris syndrome. So I'm using a cotton tip to straighten the eye, and then using a corneal marker, which will help me to center and size my rhexis. And then I'm going to make my paracentesis incision, first on the right side and then the left side. And make sure the incision is parallel to the iris plane, which creates a nice corneal shelf, which will allow me to achieve a self-sealing incision. This is some intracameral lidocaine and then some intracameral epinephrine. My staff must have suspected that this patient may have IFIS, and so we went ahead and placed some epi. I inject some dispersive viscoelastic to expand the pupil and flatten the anterior capsule. This is the triplanar corneal incision. I make a vertical groove, place the blade into the deep part of the groove, tunnel through the cornea. Using the cannula to control the eye, I'm able to enter it with a triplanar incision. I inject some more viscoelastic to flatten the anterior capsule, and this is the puncture style rhexis. I'm going to puncture the center, pull it down towards me, grabbing the right side of the tear, which creates a flap. I'm able to control the diameter of the rhexis by doing it this way, going around circumferentially, grabbing and re-grabbing, making sure I follow the marks on the cornea that I made before, which will help me to center and size the rhexis. Burp some viscoelastic at the end. So this is tip number 1. Avoid aggressive hydrodissection, because this causes increased anterior chamber pressure, and this can cause the viscoelastic to suddenly prolapse out of the incision, which will then possibly prolapse the iris out of the incision. So this is the capsular fornix hydrodissection technique. I place the cannula under the rhexis edge, I get a nice wave, but you can see I stopped. You saw all that viscoelastic coming out of the incision. I stopped, and then I was able to spin the lens. So that's the key. You saw that viscoelastic, and you have to be mindful of the iris coming out. And if you start to see that, you got to stop with the hydrodissection. So I place my instruments into the eye, but as soon as I activate the vacuum, look at the pupil, it starts to spasm on me. I place the chopper under the rhexis edge contra-incisionally, pointing the phaco tip vertically sub-incisionally, crushing and dividing the lens. That's double chop. I place the chopper around the right heminucleus, pulling it centrally toward the phaco tip, and that is cross chop. Now the lens is divided. I'm placing the chopper around that first quadrant, lifting it out of the bag very carefully, and then I'm starting to emulsify the lens. It's very important that I pull out the lens. This is tip number 2. Do not go after the lens pieces with vacuum in this situation. If you do, you might grab the pupil. And so instead, use mechanical fracturing forces to crush and disassemble the lens without the use of vacuum, as you saw with the technique here. So now I'm placing the chopper around the second quadrant, pulling it centrally toward the phaco tip, and then dividing that lens piece. So again, I'm using mechanical forces, which doesn't require any vacuum with this technique. And by disassembling the lens with a technique that does not require vacuum, I will not grab the pupil. This is tip number 3. Never grab the lens pieces with the phaco tip. If you grab it with the vacuum, you might grab the pupil edge. So instead, hook the chopper around the lens piece and pull the lens piece up out of the bag. That is really the simplest and easiest way to get after lens pieces. So go ahead and pull that piece up out of the bag with the chopper. Use the chopper, get around the lens piece. You're familiar with doing the technique because that's how you have to chop when we do the chopping techniques. So this is very easy. I spin the second heminucleus in front of me, place the chopper around the lens piece, divide that lens, placing the chopper around the third quadrant again, chopping that third quadrant and pulling the pieces up out of the bag and emulsifying the lens pieces. So this is quadrant number 4, placing the chopper around the lens piece, pulling it centrally toward the phaco tip, and I'm able to crush the lens piece. Again, I'm dividing the lens piece using mechanical forces without having to use vacuum during those maneuvers, which is good because if I go near the pupil with high vacuum, I might grab the pupil. Very carefully, I'm pulling the pieces up out of the bag with the chopper instead of going after it with high vacuum. In this way, it's a very, very controlled way of getting lens pieces without getting that phaco tip, which has high vacuum and might grab the iris. And this is the final tip, tip number 4, retract the pupil edge with the chopper to protect the iris. The chopper can hook lens pieces up, it can chop and crack and divide lens pieces, but you know what? You can use it as a shield to protect the pupil as well. And so you're going to see right here, I'm going to retract the pupil edge right here, and I'm able to get closer to the lens material, which is close to the pupil, and be confident that I'm not going to grab the pupillary edge. So I'm able to get that piece of epinucleus there, and on the left side here, I'm able to grasp the edge of the epinucleus very safely without getting near the pupil as well. So those are the 4 tips of dealing with cases with intraoperative floppy iris syndrome. Remember, when you're dealing with this situation, whether the pupil is small or big, sometimes it can happen during the case and it's unexpected. Again, you can always put in iris hooks, iris rings, and a variety of tools and devices. But again, I think it's rather overkill to use these devices with every case. And at least in the United States, having to use these devices are costly as well. And more importantly, those devices can cause complications in certain situations. And so it's very important to have exquisite control of your instruments and your hands during the case. And so that's why I feel like using these techniques are very, very helpful. So again, number 1, avoid aggressive hydrodissection, because if you're using aggressive hydrodissection that increases intracameral pressure, that means when the incision gapes, all the fluid and viscoelastic is going to come right out, and if the iris is floppy, it's going to come out too. So be very careful with aggressive hydrodissection. Number 2, do not use vacuum to grab the lens pieces. If you use high vacuum near the pupillary edge, you're going to grab the iris. And so this is very dangerous. So a better way is to use mechanical fracturing forces, which does not rely on high vacuum, to grab lens pieces, to impale the lens for chopping maneuvers. By using mechanical forces, you're essentially placing the instruments around the lens and crushing it. And you don't need any vacuum to do this. So this is a very safe and very controlled way to disassemble the lens, especially in the context of a floppy iris. Number 3, never grab lens pieces with the phaco tip. If you have a loose piece, don't be going after them, grabbing them with your phaco tip near the pupillary edge. If you do that, you might grab the iris. More safe and more easily, just use a chopper to get around the lens piece and hook it and pull it up out of the bag. It's really a routine technique that I utilize, very easy. And the beauty of the chopper is you can access 270 degrees of the area, except for the area that's subincisional to the chopper. And so they give you a lot of versatility in being able to go after lens pieces. And finally, you want to use the chopper as a shield as well. You can protect the pupillary edge with the chopper as a shield. And so when I'm going after lens pieces with vacuum, if I have to, I can use a chopper to retract the pupillary edge. It's almost like a dynamic iris hook. Using the chopper is like a dynamic iris hook. I'm able to retract the iris edge very easily as I go when I'm going after lens pieces with the phaco tip. So again, those are my 4 pearls and tips in dealing with intraoperative floppy iris situations without having to use iris hooks and iris rings, and being able to be confident with your cataract surgery. So I hope this was helpful to you, and I thank you for your attention.